And thanks so much for taking the time.
You're welcome.
Do you have any questions before we start?
Oh, at the moment, we don't have. Maybe the questions will come as time goes by. Yes.
Good. Then I start just with the first question, and that is, what is your current project on the distribution of sanitary towels to our girls from local schools about?
Yeah, thank you very much. It's all about our poor girls from our community who can't really afford sanitary pads. And being that they cannot afford the sanitary towel, they also cannot go to school. So we came up with this idea of supporting these girls for them to be able to go to school.
Mm-hmm.
Yeah, so that is how we came up with this program. Because most of the girls in the community can't afford the sanitary pads. They come from poor background. And going to school, sometimes when they are on their menstrual, can be a challenge. So they would miss even going to class just because they don't have these products.
Mm-hmm.
Yeah, so we sat down and gave it a thought, and we all agreed that this is a good program. If we help our girls achieve their academic goals in life, then that's how we came up with this program.
Okay, and how many schools are you targeting?
Actually, in schools that are around our area, we have 4 public schools
Mm-hmm.
that have a bigger population. And we are not only doing schools alone, we're also doing other schools, private schools, and also girls who come in the library, because every week we have people who come into our library from Monday to Saturday. Mm-hmm. So we have even girls who come to the library. So we identify the need, and then we share with them, we talk with them, and we know those girls who are really need of these sanitaries.
Mm-hmm.
So that's how we are doing this program.
How old are the girls, or what age group are you targeting?
The age that we target is from 13 to 18. Yeah.
All right. And you also, when we had the other meeting, you also talked about some education that they also receive.
Yeah, education that they receive. That is why we also engaged facilitators from outside who came in handy to give a talk in Mathers reproductive health topics. Yeah, most of our girls are not fully aware of reproductive health topics. So when we engage and bring in facilitators to come and help, this actually is going to be productive in the future. And
Mm-hmm.
most of the girls are going to be aware on even how to use the pads, on even how to know their rights in reproductive health topics,
Mm-hmm.
and even how to go about their daily activities of health in life.
Great.
Yeah.
Okay, I think then you also answered already question 2, or maybe Joakim, do you have anything to add about how you came up with that idea?
Yes, I can add by saying that from the community where we are coming from, we found that most of the girls are dropping out of school because they lack these sanitary towels. And sometimes some are being abused by the boys because they know that the girls do not have some money. So in order for them to get the sanitary towels, the boys, they can give them the sanitary towels, knowing that in return they will have to abuse these young girls.
You mean sex?
Yes, they abuse them sexually. So, and also sometimes they use drugs. They are being abused using drugs so that they can make the boys, the young people, happier. But on the other side is the girls who are going to suffer in the end. So that's the reason as to why we saw that there was a need for us to come with this idea. We give them some hope that despite the challenges they are going through, there is still hope that they can get the pads even without engaging in drugs or other bad activities in the community.
And how often will you distribute the sanitary towels to the girls?
So we had planned, first of all, we had planned last The first time it was, we expected about 100 people, young girls, but we found around 68 who came. And then this coming Saturday on 14th, this month, this coming Saturday, we are going to distribute, we have the second phase of distribution. The pads, and again, our target is the 100. And we have already started mobilizing people to send the girls, and normally we use the list. They give us a list of the number of girls that will be coming so that we can prepare ourselves in advance.
Who is giving that list? The schools or?
No, we have in our library, we have the attendance list. And through that attendance list, that's where we also select our girls who normally come to the library every day. And then back in the schools, then we go to the school, and then the school gives us, selects for us the girls who are going to come for the activity. Yeah.
I'm a community health volunteer I myself. So I always go and share with my other colleagues, telling them about the project. And then I ask them to send some of the girls from the areas that they are working. So normally they give me the list of the girls, then we bring and put it together. And sometimes we even advise the girls to come with the parents so that they can hear together. Because also we found that some of the girls, some of the parents, they are afraid to talk about this issue with their girls. So sometimes we ask the parents who are available to come and listen or share their thoughts concerning this, the pads. Yes.
And are can the girls come 2 times, for example? Or is it like always different the girls you target?
It's actually different targets. Yeah, we are not actually doing, for instance, the last time we gave out to 68 girls, those are totally a different group of girls. Now we are targeting another new group of girls. Then the third phase, we are going to target another new group of girls, until 4th and 5th and whatever. Yeah. So that is how we are targeting it, so that we can be able to reach a bigger number of girls in our community.
Great. And how many sanitary towels does one girl receive?
We actually, the first phase that we started off with, we gave out 2 sanitary pads, a packet that contains about 10 of sanitary in it. So we gave them pads for 2 months. Yeah, so that is enough to push them for 2 months. Then this coming Saturday again, we're going to give 2 each. Yeah, for 2 months. So then when we go to another new batch, then we give them 2 each for 2 months. Yeah.
Okay. And maybe only if you want, Joakim, you can share a bit what you do as a health voluntary worker.
Okay, what I do is normally we have some of the clients. We have clients in the community, people who are sick in the community. Normally, we try to connect them to the hospitals. Sometimes we call the ambulances because we have been given the numbers for the ambulance providers. And we also try to make sure that they get the medicines. Sometimes we find that there are some defaulters who are not going into the hospital to take the drugs. So what we do is we try to make sure that they go back to the hospital and they get the medicines, the drugs themselves. And after that, we ourselves, we are given that mandate to be in charge, to make sure that the person will be taking the drugs according to the doctor's prescriptions. And again, what we do, sometimes if we have some people who are needy in the community, when we find any help or any support from somewhere, those are the people that we try to reach first before any other person. And again, we are dealing also with cases of gender-based violence. We take if we find one, we follow the rules and we take them to the police if need be. And again, HIV/AIDS, sometimes we have counseling. We do counseling for the people who are HIV/AIDS affected. And again, we do referrals. If we have someone who is sick and cannot go to the hospital, we always refer the person to the hospital, because normally we have every week we have meetings for the community health volunteers, and we have it on Mondays, and we share how we did our work during the past week and the challenges that we have been facing and how we can overcome those challenges. And sometimes we are connected with the government institutions, and we also sometimes we do mobilization, especially during the vaccination. We go around everywhere. We are divided into teams, and we go and try to preach this gospel that people have to go for vaccination. And especially, for example, during this period of the COVID-19, we were going around and we were telling people to go and get vaccinated against this disease. And still, it's something that is going on until now. Yeah, also we refer pregnant mothers to the clinics. The defaulters also, we take them back to the hospitals. And sometimes there are some people we find that maybe they got some accident. So normally some of us can take them even to the hospital, and sometimes they spend the whole night in the hospital with the person. And you can imagine, since we don't know the person, we just met the person, you spend the night in the hospital with the person until the following day. But we hope that soon everything will be everything will be in order, so that these challenges can at least reduce. Yes.
Okay, then I think I would go to question 4 already, which is you are both engaged at the Mathare Community Center Library. Maybe you can tell a bit more what's the library about.
Yes, the library is also about boys and girls from poor background who in one way or the other come from a family of about 6 to 7 people who live in a single room in Mathare. And in this single room, when you're living 7 people in a single room, it's not easy. The environment is not conducive for anyone to study in it. And that is how John came up with the whole essence of the idea of constructing a library. Mathare is a big area with a population of about 650,000 people. And we have only one library. So when this library was constructed, it actually gave an opportunity to needy students who can't even afford to study at home, study in a dignified environment, spacious, and in a place where it's very quiet. So that is how John came up with this idea of Mathare Community Library. We've actually supported a lot of boys and girls. This initiative has actually helped a lot of needy students. Most of them didn't even know whether they could pass the exams, but we've managed even to take boys and girls to universities and colleges and other institutions. And this is how big Mathare Community Library is all about.
And also in the library here, we have different programs for the students. I can recall before the first group of students who are sitting for their final examinations, there was a moment when John had a session with them, mentorship talk, and also before how to prepare oneself before an examination. So, and most of them, they passed their exams and have been coming sometimes here to spend a day, because some are in the university now and are in colleges. And apart from also having that moment, we also have a dance group, just a group of young girls who are dancing here. So we are trying our best to make sure that the center attracts people also from out, because especially during the long holiday, we were so much occupied here with the kids and the students who are coming around to study. And sometimes we find ourselves even closing late at night. And as Julius has said, the families around, they live in a single room, and it becomes very challenging for someone to study, especially someone who is preparing for examinations.
And another thing, the library is actually helping. Currently we're working with other organizations that have their trainings, and there are no training halls or training facilities. And this is the only one facility that we have, like in the entire community, that when people want to train youths or train women, the only place they can go is here in Mathare Community Center Library. It's taking place. We've had the past 2 weeks trainings in our facility. It's ongoing until the entire week that we're starting tomorrow. So you can see the big difference that this community library is actually bringing to our community. Yeah.
Maybe can you, because you said already earlier that all the girls you're targeting are also coming. How many people come a day to the library on average?
On average, like we can get like around 70 to 75 in a day.
Wow, that's a lot.
Yeah, they even come from as far as other constituencies from here. So neighboring constituencies that we have closer to us, people come far from that. So it's actually serving a bigger population. So in a near future, we're looking forward to maybe having another library in another location just within Mathare area, so that it can actually help the other population that we have the other side.
Mm-hmm.
Yeah.
Yes.
And are there any like tutors or mentors or teachers also present to help studying, or like to answer questions, for example? Is it really just a place to study?
It's a place actually to study. And sometimes we even have mentorship programs. We invite people to come and talk to our students. Even us ourselves, we are trained, we know how to do mentorship programs. We talk to boys and girls and take them through and give them direction and what have you. So this is how it actually operates.
And also, since we have some of the students who are here before, sometimes they come to volunteer to help others here who have challenges, maybe in a certain subject, and they are good. So we always try to engage also those who are here before, tell them to come back and give back to the library, whatever they got to share with others. So sometimes they come and share with us and with also other students what they have to offer. Yes.
Great. You also have, I think, a basic computer skills course maybe, or with Leapfrog together. Can you tell a bit about that?
For myself, I went to college and learned how to use a computer. So it's something that I learned in school. So I have that information with me. Joakim, I think the same. We all have that knowledge. We do even take them through some of our challenges that when they're going through, we come in and help them.
What is your personal motivation behind working voluntarily for the community library?
What motivates me most of the time is help, the sharing. Yes. I like sharing whatever I have with people in the community. If I have something that I feel that I can share with someone and it can help someone and create a positive impact in the person, normally I share it. And that's what motivates me here in the library. Because when John started the library and he asked me to come and to help, I came knowing that this thing is going to help many people who will be coming after. So apart from that, there are many things. Normally, I do share a lot mine is just to share. If I have something that I can share with someone and it will create a good impact to the person, I do share it voluntarily. Yes.
And Julius?
What motivates me is that the fact that we come from a challenging environment, we can still bring change in our community and society, despite the fact that there are a lot of challenges. And I can still see in these challenges, we can still bring positive change. You can imagine what it means. You know, challenges are here and there, and we can still, we have actually reached quite a number of people. We've talked to quite a number of people. We're seeing change in them. We're seeing positive results. Students are going to universities, going to colleges. We training people in digital literacy classes. So it's a good thing. It's something that really motivates me a lot.
And are you both yourself from Mathare, or do you come from somewhere else?
No. We
are from
this community.
We are from this community.
Born and bred.
Thanks so much for sharing. And okay, then my next question would be, what will happen next at the library?
What will happen next at the library? As I had said before, this coming Saturday on 14th, we have the second session when we will be distributing the sanitary towels to the girls. And already we have started getting the names of the girls from different areas around Mathare. Our plan also, we have invited someone. Last time we did it in the morning hours. And this time we are going to do it in the afternoon because the schools have been opened and some will be in school in the morning on Saturday. Unlike the other days when it was during the holidays. So we will have a session together with them, and also there will be a moment when there will be someone who will be giving them a mentorship talk or health talk.
Okay. Another thing is that we are sitting down and we are going to work on how we are going to start a youth program just within the library. And we are also going to have a peace initiative. You know, we're heading to a general election coming just in 2 months' time. And we want to go and talk to the people in the community about the importance of peaceful election. So it's when it comes from us, people will see the sense and the need and the urgency of peace in the community. So those are some of the things that we're actually going to do. And especially the youth program, it's something big that we are going to do. We are even targeting a youth program within our library.
And also we are planning in the future, also in the near future, to have a moment when we'll be in one of our programs to have a session with the whole group of young people, and we have a sharing concerning the use of drug abuse, early sexual encounters, because those are most of them happen within our surroundings.
Those are the biggest challenges that we have currently. Drug and drug substance abuse is commonly. Drug is abused here in the highest rate in Nairobi. This is like the core of all drugs being abused in Nairobi. It's in Mathare. So we're working so hard to see that in the near future that most of our youths don't engage themselves in those kinds of activity. And we're working it through the library. So we are going to engage other people who are well informed, who can come and work with us, partner with us, and help us even train our youth on drug and substance abuse. So those are some of the things that we actually have in plan to start doing.
Oh, sound great. Okay, and then that's already kind of my last question, unless you have anything to add, which is, what are your personal visions, dreams, and hopes for your personal future and for the future of your community and the library?
My personal vision dream and hope, my vision is I want to see an environment where despite the challenges someone is going through, the person should know that always there is light at the end of the tunnel. And also, if we have people with the same mentality that we can achieve this despite all these challenges, we can do this, and we become better people in the community, I myself will feel so much proud, because according to the environment where we live, we have seen so much that sometimes we ourselves, especially I can say it, I, Julius, because we come from the same place, sometimes it forces us to take some of the young people who we know, we take them and sit together and we try to share with them everything that we think is better for them. And also sometimes we talk with the parents. I just want to see that despite the challenges that we are going over, someone is going through, the person should not think that that's the end of life. No. The person should know that this is just a stage in life. But now what matters is how will the person pass to the next stage. And if the person finds people who are focused and who are ready to help the person, then the challenge will be overcome very well and very peaceful.
Thanks.
Okay, thank you. My dream is actually to see if we can have another Mathare Community Library in the near future. For now, you see, our library is only one and it's serving a bigger population. So if we could scale them up and have another Mathare Community Library in the near future and another Mathare Community Library in the future, that population of around 650,000 people, it will be actually balanced, and we will have a lot of students and youths who will be able to achieve their academic goals in the future. Another thing is to empower our youths in matters academic. That is one dream and vision that I have. And another thing is to help and support our youths reach their potential through mentorship programs. That's another thing. And then give hope. You know, hope is everything. Give hope and direction to our boys and girls, despite the fact that there are a lot of challenges. Hope is key. So if we give them hope and direction, then at the end of the tunnel, we shall see the light. That's it. Thank you.
That was a wonderful ending from both of you. Thanks so much. Do you have any questions or anything to add? Or maybe Swarup has any questions he wants to ask?
What I can add, mine is not a question. What I can add is we are trying our level best to make sure that the young boys and girls within the community find that life is always bright to everyone, no matter what challenge someone is going through. But this will only depend on how someone will be taking each stage of life. If the person takes each stage negatively, then in the end, things won't be better. But if the person takes them positively and with the right people, then everything is going to be okay for the person. So what we do is just encourage these people every now and then. We encourage them that just keep moving. We should not stop. Just keep moving and keep knocking to the other side, and then the door will be open for every person who wants to get in.
Thanks.
Mine is just to say that as the entire world, we've actually gone through some of the difficult moments in life. The entire globe, we had the pandemic. It's that problem that actually affected the entire globe. And then the second one is this Ukraine-Russian thing. It's actually affected the entire world. You know, it's not even easy back in your country. I know you were so much dependent on Russian oil, gas. It's actually affecting the entire globe in our country, Kenya. But at the end of the day, if we work together, if we put our minds and heads together and hearts together, then with a little and minimum amount of resources that we might have, we can do bigger things. Sometimes in life, it's not all about the big resources that you have that does bring change in life. It's even the small amount of resources, when put in the right place, it brings big changes.
I just thought of another question. How many hours or days per week do you volunteer at the community center?
That's a very good question. We actually, we have other things that we do in our day-to-day activities in life, but we spend like around 6 hours daily in the library. And
6?
then the rest, 6, yeah.
Whoa.
You know, in the library, we're dealing with young boys and girls who actually need direction. If we are not there, then they do other stuff that, if they're not guided correctly. Yeah, that's why we put more of our time here, because we have a lot of things. We have laptops, we have books, we have drums, we have a lot. We have what you call a projector and other machines here. So we cannot leave it only to the youths to stay around here. We need someone who gives direction.
Mm-hmm. And how big is your team of volunteers?
We are only 4 of us.
Oh, okay.
Yeah, only 4 of us.
And are you trying to get more people involved in volunteering, or?
At the moment, we do get people volunteering, but first of all, we have this group of students who are here before. So after the exams, after their final examinations, normally they come back as they wait for the results to come out. And that's when they help in whichever way they can here. Maybe in cleaning, few things. They do just few things that can be done around. So first of all, we give them the chance to help in one way or the other here at the library before as they wait for the results to come out.
Okay, another thing that I think I would actually let you know is that in our library here, we have, I think we have 3 departments. One is a library, the second department is computer lab, and the third one is culture, dance and culture. We have a dance and culture group of, we have a teacher and girls who do dance and culture. So that's another department. I come in as a program manager. I run day-to-day activities of the library. That's how we run the library. Mm-hmm. So as time goes, I think as we grow, then it will be a bigger thing. Then we will really need more volunteers. So for now, because it's still a small place, you only need 4 people to give in their time to help in running the place.
Okay, yeah, thanks so much for your time. It was very enlightening.
Yeah.
Good.
Thank you
very much.
Yes.
Okay, thank you.
Greetings to your team.
Yes, I will. Thanks so much.
Okay,
bye.
Bye. Bye. Thank you.